Now that we've spent some time locating the cranial bones on our practice skull, and I'm going to demonstrate to you how you're going to go about identifying the exact location and bony landmarks and outline of each cranial bone on my practice skull here. You're going to do it on your live models, and it's important to be able to identify the size and shape of each cranial bone because it does differ from one person to another. Some people might have a very wide forehead, some people might have a very rounded occipital base. People have different shaped heads, and so when it comes to treating your patient, it's going to be important that you know that you're positioning your head in the exact location. In the same way that when you're treating elsewhere in the body, you want to have your head in the exact position in order to be effective in your treatment. We're not doing global energetic work, we're doing very specific biomechanical cranial work. So let's look first at our frontal bone. Remember, we looked at it earlier on our skull, on our practice skull, and we saw how the frontal bone actually makes up a good portion of the orbit of the eye. But now we're also going to identify on our practice skull the exact location whereby it comes to an outer ridge and then kind of dips down here, and this is where the sphenoid is going to be found. So when we're working on the frontal bone, it's going to be important that we remain within the outline of the frontal and that we don't go down too far and start contacting other areas or other bones. Then notice how the frontal actually comes up and is quite large, goes quite far past the hairline to become the coronal suture where it intersects with our two parietal bones. So if we look on our practice doll, most of the time when I start with a patient, I like to start with the frontal, and this is the way I teach my students to do, because it seems kind of instinctive and natural that this would be our first contact point when you're coming to work on a client. Now, in the same way that you would do a visual assessment of somebody, in order to look at their posture, you would look at them standing up, sitting down from different angles. In cranial osteopathy, our eyes are our hands. So in order for us to be able to do a quick assessment and survey and overview of where everything is located so that we can know how we want to start treating, we're going to use our hands and our fingertips. So let's start with our frontal. Remember I said that the frontal bone actually makes up the superior half portion of the orbit of the eye. So if we want to try to trace the frontal bone, we're going to actually come down beneath the eyebrow into the orbit of the eye. We're going to trace it along here, so we're actually going to kind of close our eyes and just follow that with our fingers. And now we're feeling for bone, which is very different than if we're feeling for muscle or ligaments or tissues. We're feeling for something hard underneath the tissues. And that's going to be important to keep in mind, because as we trace our frontal bone and we start getting to its outer edge, we're going to notice right about here, past the eyebrow, right about here, we're going to come to the outer edge of the frontal bone. So the frontal bone transverses across and then starts coming up like this. It's actually approximately this shape. We know that we're at the outer or lateral edge of the frontal bone because we're going to feel a bit of a ridge about here. Feel that on your client. And then you're going to feel that if you go further laterally or outward, it's actually going to kind of dip down a little bit, and if you press, you're going to feel that the tissues feel kind of spongy. We're in the area of the sphenoid now, or what people call often the temples. So as we're tracing the outline of our frontal bone on our client so that we know where to place our hands specifically when we come to treating, we're going to come to the edge of that bony landmark. If we go a little further up, now I'm in that crevice, that dip, that softer area. That's the sphenoid. I don't want to be there. I'm going to come a little bit higher up. Oh, look, if I were to go further down, the frontal bone actually connects with the cheekbone, the zygomatic bone. So we're not going down there. We're following along here. And then the frontal bone actually comes up past the hairline till about here. And this becomes our coronal suture. So this is the area where the frontal bone actually connects with the parietals. So if I were to trace the outline of the frontal with my fingertips, I'd be starting with our fingertips close together, just right above the nose and right into the orbit of the eye. I would follow it all the way out. I want you to do this with me. till you get to that edge. Oh, now I'm on the edge of the frontal bone, and now I'm going to trace it all the way up. I'm going to come up to about halfway point right up here, which is where the frontal bone connects with the parietals. So if our frontal bone is actually this, notice it's not transversely across. A lot of people think, the frontal bone is like the forehead of a person. It actually encompasses part of the orbit of the eye, really only comes out about this far, and then comes up and around. So when we want to contact the frontal, knowing that and now having established the shape and the bony outline of the frontal on my client, I know that I can place my hand like this, right? And so notice my fingertips are actually coming down quite low, right? Because this is the frontal bone here. It encompasses part of the orbit of the eye. Also, it comes up past the hairline up here. So from about here to here is where your hand can actually contact the frontal bone safely in order to treat it. Now we want to make sure that our thenar eminence is not cupping and holding the whole head, because if we were to do that, we would have gone past the coronal suture and our hand would actually be touching the parietals. We don't want to do that. We're tracing the outline so that we know that we always want to remain medial within that suture, so we want to remain within about here. If you wanted to work with two hands, you could work with them this way. So once again, our fingertips are coming right down, right above the eye into the orbit of the eye. Our hands would be curled so that we can come up and contact right up until its edge up here near the parietals. Open out, flare out the areas of your hand that are not contacting the frontal bone. So you're not doing this. We're going to curl our fingers, maybe even cross our thumbs, so that what are we doing now is we're contacting only the frontal bone. Another way to contact the frontal bone is in a transverse fashion with your hand like this. And once again, same thing. Why did we establish the bony landmarks on the outer lateral edges? To make sure that we're not doing this and that we're not actually grasping the sphenoid or the temporals. Our hand actually has to be on the frontal. So notice my hand is going to curve a little bit, and I'm going to kind of grasp the bone, because the frontal bone, as we saw, is also curved, and that will inform the movement and the direction that it'll go, which we'll discuss later. So when we contact the frontal bone with our hand, we're going to make sure, see here, that we're not going much further. Our outline of our frontal bone is approximately here, so my finger is going to be there. Same thing on this side. I'm going to curve my hand so that the tip of my medial finger and this portion of the hand where the thenar eminence is going to contact the two outer edges of the frontal. We're not going to be grasping in a large open way. We're going to be very specific about holding the frontal bone only. So two hands, one hand like this, or in a transverse fashion, depending on what it is that we're going to be doing when we're working on the frontal bone. Very good.